Good morning. Good morning, ladies and gentlemen. Thanks for joining us this morning. We're going to give a few minutes just as everybody starts to join this live feed. I see our guest is online already, so I'm going to be with you in a minute or so. Lamar Louise. Morning, Kerry. Morning to Neil. If you don't know, my name is Warren. You can find me at Warren FM11. I am a brand director here at MamaMagic. I'm a father of two. And this morning, we have a great sleep expert, Nicci, that's going to be joining us. Sleep is one of those topics that we all need help with as parents. Doesn't matter how old your kids seem to be, we need help with sleep. I think I had very different experiences when it comes to sleep routines and sleeping with both my kids, and it made life. One was an absolute challenge. The other one made life seem so easy. At the same time, they're much older now, and even though they're no longer babies, as toddlers, I still struggle. So, good morning to everybody that's joining us this morning. Welcome to the MamaMagic Live. We'll be in conversation on a regular basis with experts that you can learn from, ask your questions to. So if you ever want to know what's happening in MamaMagic Live, make sure you stay connected to us and check out our stories. We've got a sleep expert this morning that's going to be joining us. So I hope that you've got your questions ready. We've got a whole bunch of questions that were submitted beforehand already, so we're going to be getting straight through to those. So if you've got any questions, please be sure to send them through here. We're talking sleep this morning, and I'm going to get our guest in. Her name is Nicci, and she is from Bedtime Baby. Nicci comes in and joins us. Please, if you've got any questions regarding sleep, please send them through. I see Lala's already saying, excited for this chat. I'm pregnant with my first and have no clue. Good morning, Nicci. How are you this morning?
I'm very good. How are you?
Very well, thank you.
Good.
I know I look a little bit like a sleep-deprived parent, and I was saying earlier that even though my kids are older, yes, they still come and get into bed at night. We still struggle to sometimes have them sleep through. There's so many challenges when it comes to sleep, and we've got lots of questions to get through this morning. A lot of pregnant moms joining us who are all very anxious about sleep. We know that I know my own personal experiences that sleep is like an Achilles tendon. That without it, you can become a very, very different person. Some people cope well with it, and some people don't. But maybe just give everybody and our audience a bit of introduction of who you are. I know you're a sleep consultant, you're a dietitian, you've got so many qualifications behind you, but just tell them a little about who Nicci is.
Okay, sure. Okay, so my sleep journey actually began many, many years ago when I was actually a teenager, where I used to volunteer at a creche. And instead of going off to clubs and all of that jazz, I was obsessed with learning more about being independent and earning my own money. And there was a very particular creche mum that used to basically click her fingers and say, right, it's time to sleep. And all the children would lie down and it would be lights out. And I would be fascinated. How did this creche mum get this right? And it set this little seed in my mind. I want to know, what does it take to be a good care provider? Because this creche mum never raised her voice. She never had to discipline. She was a godsend. And it was this creche mum that set me on the journey to basically be the next super nanny. And through the introduction of au pairing overseas and becoming a teacher and then qualifying in my stimulation specialist through the Moms and Babes and then becoming a sleep specialist, I then developed this passion of finding different ways to get our children to eat, sleep, and be stimulated through a variation of all the way from gentle sleep parenting through everything in between, through all the way to crying out. So luckily, I'm in a position where I can carry through all realms of parenting. So there's no such thing as a one plan fit all. It's a personalized journey for every single family. It's fantastic. I love what I do. I'm obsessed.
And don't you find, Nicci, I love what you're saying, because don't you also find that there's not one approach? And also when you've got different kids, I mean, that's my own journey, is that your approach would need to vary from child to child. Like it might be when it comes to sleep or discipline or anything else, from one child to another, they are so different. And you would have to change your approach depending on the child, their behaviors, how they respond to things.
Absolutely. And that's what parents ask me all the time, because they want to know, okay, so I don't want to do cried out and I want to stick to gentle parenting. And I say, yes, let's do that. And then I have other parents who say, I'm sorry, I'm not a gentle parent, I want to do cried out. And I have to explain to my clientele that it's not actually about your parenting style. It has to go according to what is your child's personality type. Do we have a strong-willed child? Do we have a high-needs child?
Mm-hmm.
We have to fit our parenting according to the needs of our child. So if we have a child who is extremely dominant, they need a little more pushback. They need a little more guidance into how we develop their sleep needs, rather than a child who is a little more easy flowing and they adapt to the plan a little more easily. So it really is more about what the child needs rather than your parenting expectation. Because what we tend to do is we have an expectation as to how we think we're going to parent, and we kind of fall into accidental parenting, where we find ourselves in a position where we're like, this isn't how I thought it would be like. The book said this is how it should be going, and it's not. So we really do have to look at our child's personality and parent according to what that personality needs.
So I think that's so awesome. We've got, like I said, we've got lots of questions that have already been submitted, so we're going to get straight into it. But if you've just joined us this morning, we have sleep expert Nicci that's with us. So please be sure to drop your questions into the comment box below, and make sure that we'll try and get through as many questions as we can. So Nicci, I'm going to get straight into it. We've got a lot of different questions. Like I said, sleep varies from baby through to toddler. There's still parents who are still struggling to get through a full night's sleep themselves. But here's your first question. How long should my baby be sleeping for?
Okay, so this is definitely age dependent. And you also have to look at your high sleep needs and your low sleep needs child. But I can give you an estimate.
Yeah.
So for example, we can't look at the newborn, because the newborn, their body clock is still developing. Okay, so that's very intricate. But what we can look at, for example, is your 4 to 7 months, you will be looking at around about 3 to 4 naps a day, 2 short naps, 1 long nap. For your 4 to or let's go from your 4 to 7 months, you'll be looking, oh, just on that, sorry. Your 4 to 7 months, you're looking at 3 naps a day. From your 8 until 18 months, you're looking at 2 naps a day, a long nap at noon, and then a short nap in the morning. And then from 18 months until 3, you're looking at 1 nap a day. It varies from a long 2 hour down to about 45 minutes at 3.
So, there was another question around nap time. And there was a parent who was asking, they've got a toddler and they try and get their child to bed in the evening by 7 p.m. But the toddler has a nap in the course of the day and they're struggling to get the child to bed. Do you think that then by the later years of toddlerhood, you need to start dropping those naps if getting to sleep early is a problem?
Yes. See, the thing is, it's very difficult to decide when it's time to drop a toddler's nap, because toddlers are so unpredictable, and also their will starts to develop. They can become very
I just want to pause on that.
Are they ready to drop their nap, or are they being defiant? It's an emotional over biological need. So the rule of thumb is a toddler is ready to drop their nap round about the 2.5 to 3 year nap if, one, they are struggling to go to sleep at night for at least 45 minutes to an hour. Two, they are waking up after midnight more than 2 to 3 times. And three, they are waking up at least an hour to an hour and a half earlier than usual. So one, they're taking a long time to go to bed. Two, they randomly waking up after midnight. And three, they're waking up much earlier than usual to start their day. And those are the 3 indicators that your toddler is ready to drop that afternoon nap.
I think that's great, because that's really helpful. And I think sometimes we need to be able to base it off some kind of benchmark. And I think those are really great points to help that parent. What is the best tip to get your child to sleep through the night? I mean, I don't know if there is such a tip, and if it is, can we please coin it after this live? But we struggle a lot as parents to get our kids to sleep through the night. And I think, you know, I remember when my kids were small, a lot of their friends, my friends, their babies were sleeping through the night, and our kids weren't. So how do you kind of find the balance, and when is it really disruptive? Because sometimes they can wake up 4 times, 6 times, 3 times. But when is it, how do you know it's a problem? Because I don't think there's a golden rule to say you can help your child sleep through the night.
Okay, so there are 3 main factors that play into sleeping through the night. The first one is age dependent. So we have to have realistic expectations. So we wouldn't expect a 12-week-old to sleep through the night, because nutritionally they need to eat. So we don't want a 12-week-old to be sleeping through the night. But a 12-month-old can sleep through the night. So the first one is age appropriate. When is an appropriate time to sleep through the night? And that is anywhere between 4 and 9 months. Okay, so age appropriate factor we have to look at. The second factor is, are they getting enough sleep during the day? Because if they are not getting enough sleep during the day, they are going to have a rise in cortisol. And if they have a rise in cortisol, within every sleep cycle that they go through overnight, there's going to be a break in sleep. And unfortunately, after midnight, the sleep cycles that we go through are a lighter phase of sleep. So you will find that they might sleep well up until midnight, and then the sleep is broken or more broken after midnight. So you have more wake-ups after midnight. That is a sign that your child has not had enough sleep during the day. So that's the second factor. Have they had enough sleep during the day? If they wake more often after midnight, then that's a no, they haven't had enough sleep during the day. And then the third factor is the sleep association. How your baby goes to sleep is how they're going to stay asleep. So if they have something like a rock to sleep association, if they fall asleep being rocked, they're going to wake up every sleep cycle needing to be rocked back to sleep, rocked back to sleep.
Yeah.
Or if they go down on a bottle, they will wake up needing to be fed back to sleep, fed back to sleep. So we have to look at 1, age appropriate, sleeping through the night. 2, are they being given enough sleep during the day in order to lower the cortisol levels to be able to biologically sleep through the night? And 3, have they got any negative sleep associations that are directly affecting their ability to settle from one sleep cycle to the next independently?
I think that's, that's so true. And we've got lots of questions that are coming in now, and particularly about soothers and removing people as they come, soothers that we use to put babies to sleep. Welcome to Zintle. I see you're in the house with us this morning. I'm not sure how Kyra was when she was sleeping, so maybe you can give us some info on that. But here's some questions that we got in now, Nicci. Here's from Amy Momberg. How do I stop bottles at nighttime?
Okay. So we have to choose which bottle we're going to remove first. We can't just go cold turkey, because obviously your child, if we've got, for example, fictitiously speaking, taking 6 bottles overnight, their body or their tummy has become accustomed to that. So let's say, for example, they're taking 600 mils overnight. We can't all of a sudden take away 600 mils because they're going to be starving for those 600 mils. So what we would do is say they're getting 600 by 100. Let's say they're getting 100 mil top-ups.
Yeah.
We will then take 30 mils from each bottle, one at a time. So we'll take the last bottle of the night, take 30 mils from it. Next night, take 30 mils from it. Next night, take 30 mils from it. Drop the bottle. Then, after those 3 days are done, we'll tackle the second to last bottle. Take 30 mils from it. Take 30 mils from it. So you see how we're doing this. We are gradually reducing the amount of bottles that they are having so that it's not a massive impact. We can go cold turkey, but it's a little bit more invasive and you can expect crying. But if you do it slowly by reducing the amount of liquid that's going into their body, there shouldn't be that much of a drastic change or response from your babe. All you do is settle them with their dummy or a little shush pat on their bum if they do wake up for the bottle that you have now taken away slowly.
Yeah. So
it's more of a gentle approach.
Absolutely. I think that's a good starting point. I think sometimes very invasive approaches are very difficult sometimes emotionally for some parents to take on, and I think it's always important to first start the gentle approach. That would be my opinion as a parent, would be to start the gentle approach first and see how you and your child respond to it, and before you have to take any additional measures in any sleep routine in any sleep routine.
Yeah, absolutely.
I've got another question here. This is from Cans, and there's quite a few questions we got beforehand about the same topic. She's got a 14-month-old daughter, and she's having problems in particular with night terrors. Specifically, she says that when she misses afternoon naps, she's waking up twice during the night and never sleeps through any advice. In particular, I'd like to touch on the element of night terrors. Is there a way to prevent them? How do we help them pass through this phase? How long is this phase expected to last for as well?
Okay. So there's so night terrors generally only starts occurring past the 2-year mark. Okay. What we typically misdiagnose night terrors with is a heightened cortisol. So cortisol is a stress hormone. So if your baby has gone to sleep with a significant heightened cortisol, they will absolutely wake up between sleep cycles hysterical, because the stress hormone is so high and they are so tired and they are desperately wanting to go back to sleep. But because the stress hormone is so high, they become obviously distressed. Where are they? Why are they in their cot? Where is their soother? So the difference between a night terror and a nightmare and a partial arousal or a confused arousal are all very closely linked. But in regards to a night terror, yes, it's absolutely possible for a 14-month to have a night terror, but the possibility of it being a heightened cortisol, if a nap is being missed, then it's actually more likely to be very, very overtired. What I would do is concentrate on a 14-month-old. I suspect there's only one nap involved. I would go to a little cat nap in the morning and a 2-hour nap from 12 until 2.
Okay. And obviously that's
I suspect that there's only one nap there.
And obviously that routine is really important on a day-to-day basis. And I think even in lockdown now, if your kids were at school, they were used to a very specific routine. And I think that's really important, is to keep that routine. Cans does say that her 14-month-old is on 2 naps a day. So there's probably something else that you would need to look at with regards to that. Nicci, I've got more questions flooding in here. A lot of them are covering very similar topics. The one is, and that seems to be about babies being breastfed during the night. We've got people who have 8-month-olds, You've got others who are waking up two, 3 times to breastfeed at night. But how do we? A lot of women are asking, how do they stop that breastfeeding at night? I'm assuming it's very taxing on anybody, and I think as dads, it's a very hard one to help out with, because I can stay up, I can sit up with you, and I can keep you company, but there's very little that I can do other than maybe burp the baby afterwards. But if a lot of women are looking to transition with the older baby out of breastfeeding at night, how do they do that?
Absolutely. Now, I breastfeed both my children, and they wean themselves. My eldest at 18 months and my youngest at 15 months. So I can absolutely relate to your children wanting and needing to be soothed by the breast. But what I don't recommend is soothing through breast overnight, because it is not a static soother. We obviously want to provide a nourishment overnight to our babies who are genuinely hungry, who need that nutritional input at night. But if we're going to use our breast to pacify overnight, it has to be something that we are willing to provide for at least 18 months through to 3 years.
Wow.
That's a sacrifice that we have to make. So we either continue, or we choose a static or a positive sleep association, which is a dummy, or a dummy doo-doo, which is a toy of such that we use to provide self-soothing. And I completely understand how difficult it is to not breastfeed to soothe overnight, because it's quick and easy and we know that it works. But emotionally, in the long run, it's not fair on our baby to provide it at one wake up and not at the next.
Okay.
So to chop and change, we really have to be consistent. So we either use our breast at every single wake up for at least 3 years, or we move on to a static self-soother.
I think that's a really interesting one. And maybe as parents, sometimes we sometimes get so tired, to be honest, that you're not thinking those kind of things. So you're not necessarily maybe assessing, is the child using me as a soother, or is the child actually using me to feed off? And sometimes we just want to get back to sleep ourselves. So the easiest thing is kind of take out the breast and continue sleeping. But that leads on to another question. I see that come in from Monkey Monks, and we've got a few other questions about the same topic, is about when your child requires you to fall asleep, and particularly whether they're young or they're older, they require a specific parent, or they want to sleep in your bed with you all night. How do you tackle that? Because I've got a 3-year-old even, and she'll many times, in order for me to put them to sleep, I've got to lay with them. And they'll wake up in the night and they'll come to the bed because they want that physical touch to know that we are around. But how do we start creating that separation as kids get a little bit older? And will they grow out of it? I'm hoping.
Absolutely. See, the trick is you have to find a settling technique that draws you away from your child slowly. So I use a technique that's called a gradual withdrawal from a parent. So initially, you actually camp out at their bedside for 3 nights. So you pop off on a mattress for 3 nights and you don't leave them, because you want to give them the security that they are okay. And then from there, you will then sit with them until they're asleep for 3 nights. And then you sit in the middle of the room with them. And if they wake up, you say, it's okay. It's only time to sleep. From there, you then sit at the doorway. And if they wake up, you say, it's okay. It's time to sleep. So under no circumstances do you run in and say, it's okay, I'm here. Because now you're telling them they're not safe if you're not there.
Oh, wow. Oh, wow.
So we're actually playing with their mind to say, it's only time to sleep, it's fine. Whereas prior to that, we were giving the illusion that, okay, now I'm here, now it's okay.
Wow. I'm learning so much. This is really helpful. And if you've just joined in, we're talking to Nicci about sleep and the use of sleep and sleep routines, etc. We've got so many questions, Nicci, to get through. So if there is any other questions, please do drop them in. We're trying to just group them together. I know we didn't quite resolve Kansas situation, but I'm sure we can come back to that, or we can look at an offline discussion about that. But here's another one about why does my newborn wake up as soon as I lay him down?
Okay, so with a newborn, it takes them a lot longer to fall into a deep sleep because their sleep is still maturing. Okay, so it can take as long as 20 minutes for them to go into a deep sleep. So the suggestion is to, number one, with our newborns, we want to rock, 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 rock. Okay, so we can rock them for up to, that's it, we can rock them for up to 15 to 20 minutes. And then the trick is to put them down bum first. Bum, then lower head. Because by putting head first, what we're doing is we are rushing the blood to their head and we're waking them up. So we lower bum first, then head, place onto side, pat, 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 voila. And it's practice, practice, practice.
Wow, that's really, really helpful. I almost feel like you're taking me back to my antenatal classes, and I could get ready for a third child if I keep getting tips like this. Here's another question. It says, my daughter sucks her thumb when tired and falling asleep. Any advice on how to stop this? And I suppose this would be with any type of shusha or blankie or teddy or anything that becomes
age dependent. I would have to know the age of the child because thumb sucking is a biological instinct to suck, to soothe. So if it was under 2, I would say leave it. But it's age dependent. For example, for a 7-year-old, that would be an unnatural mechanism. So that would need a little chat with either your 3.
Yeah.
Okay, 3 is still within normal realms of self-soothing. Give her another 6 months to self-soothe, and then you can start placing some aloe vera gel onto fingers. Start doing some play therapy with her. Incorporate a little dolly for her to start attaching to at night, and then you can start putting some stop it liquid on the finger. But 3 is still okay.
That I think that's helpful, Nicci. Now, I think when it comes to slightly older kids, there's this, there's a lot of talk, but just maybe break the myth for us. Does screen time before bedtime affect sleep?
Sorry, say it again.
Does any screen time before bedtime, does it affect our sleep?
Yes, it does.
With adults or child?
Yes. Absolutely. So what happens is that the white/blue light actually decreases or prevents the body from creating melatonin. Okay, so it's a melatonin blocker. And what melatonin does is it is the sleepy hormone. So this is the hormone that relaxes us prior to sleep and puts us into a deep sleep. So anytime within 30 to 45 minutes prior to nap time and bedtime, we want to alleviate all screen time. I'm not saying that we shouldn't be watching TV at all. I'm just saying prior to nap and bedtime, 30 to 45 minutes, do not expose, because you will be blocking the production of melatonin. And melatonin is critical in our toddlers, babies, and children going to sleep.
That's really good. I think that, sometimes it becomes such an easy thing. We actually forget that when we're struggling with kids sleeping at night, then there's an underlying issue. Maybe it's screen time. Another question we got around that is, does teething affect sleep time? Because sometimes the child has a bad night's sleeping, and we've forgotten that they're in a new sleep cycle, or they're in a new milestone of their life. There could be teething. Does teething really affect your sleep routine?
Yeah. So in regards to teething, it absolutely does affect sleep during the cutting stage. So moving in the gun and all of that jazz, absolutely not. Science does not lie. So if you look at all of the medical journals that have actually studied teething and sleep, no. However, looking at the actual studies surrounding the cutting phase, where the teeth cut through the gum, because the child is undergoing substantial discomfort during the day, they are niggly and they are frustrated and they are working off more energy than usual. So they are more tired, which means they need to sleep more. And more than likely, they're going to get less sleep because they are niggly. But during that phase, because they're getting less sleep, they're going to wake up more during the night. So yes, during the cutting stage, your baby is going to, or most likely, not every baby has bad teething experiences, but the ones that do, yes, it can absolutely affect them negatively. So we want to provide more opportunities for them to sleep better during the day so that they can sleep better at night. And the fact is, when we lie down, our our blood pressure drops slightly, so it actually reduces pain. So lying down is actually better for our teething baby. Surprise!
Wow.
So sleep will actually better their teething pain.
Here's another question around going to bed, and it's come up now with about a 2-year-old, but she's talking about when should she stop having a bottle with a 2-year-old and waking up in the middle of the night crying for one. But the second part of that question is what I'd really like to touch on is this child is 2 years old, is also busy potty training. And I think also when you're doing potty training, you know, there's so many different ideas about this, and it goes back, sometimes you work so hard to get the sleep cycles right and get sleep right, and then some ideas around potty training is that you need to wake them up on a regular basis to take them to the toilet, or you just stop them having liquids a lot earlier. But what's the best way to tackle potty training when you've got a toddler and without disturbing the sleep?
Okay, so that's a really easy one. Your child is not ready to potty train overnight until their nappies are dry in the morning. Okay,
Easy.
so that's very simple. So typically what happens is that the body matures by itself. So during the day, potty training and overnight potty training are two very different mechanisms. You know that your child is ready for overnight potty training once they go to sleep in a dry nappy and wake up in a dry nappy. If your child is having overnight bottles, they are not ready for overnight potty training, because you are going to be setting them up for failure because of that overnight bottle. So once you have alleviated the overnight bottle and are then having dry nappies in the morning, then you're ready for no nappy overnight.
I love that. Got another question that Naz has just asked, but I'm assuming it's picking up very much on what we spoke about earlier, and that's about a 70-month-old baby who's in a cot and wants to sleep with them. And I'm assuming that approach that you spoke about earlier could be used for an older kid. But when is the right time to take a younger baby? Should they be sleeping in your room in a cot? Should they be sleep? Is it okay to co-sleep? When should we stop co-sleeping? When do you move them to their own room? That progression, maybe you can just kind of talk us through some tips about dealing with from newborn through to toddler and putting them, eventually having them in their own bed and walking through that cycle that you spoke about earlier.
Absolutely. So there is no right and wrong way in regards to where your child should be sleeping. Should you co-sleep? I don't know. That's your family's decision. But if we look at the recommendations from the World Health Organization and American Pediatrics, they recommend that your child sleep in their own cots from birth, in your room until 12 months, in their own room from 13 months and onwards. However, if you want to bed share, that's your choice and that's okay. You don't have to go by the rules if you don't want to. It is your family. And whatever works for your family works for your family. If it's not working for your family, then you can reach out and choose a different way. What I suggest in regards to when to move baby, we or I don't recommend moving our baby out of the cot until they will, not they will develop, but they what is the right word? Oh, I've got an absolute blank. Actually, wait, hang on. Give me 1 second.
I'm loving the fact that you talk about that there's no right and wrong way, and I think people and parents really have to decide what works for them. You know, is particularly when it comes to co-sleeping, and there's some that you do that with. I think that's really important. But you were saying, let's pick up what you're saying.
There we go. So sorry. From 2.5, that is when I recommend popping our babies into their own bed without a cot, because impulse control. Our toddlers do not have the neurological ability to control their impulse until that stage, because that is only when impulse control starts to develop. Around 2.5, 3 is when impulse control starts to develop. Their sense of responsibility, their sense of this is what I've done and now there's going to be a consequence, really starts to develop. So putting our babies into their own bed at 18 months, at 20 months, we're really setting them up for failure, because if they're going to come crawling through or running through 10, 15, 30 times at night, we can't neurologically expect them to stay in bed or emotionally understand the concept of staying in bed, because they're just going to keep coming through. They don't have that neurological maturity to understand the concept that we are trying to drill into them. So if you aren't going to bed share and keep them in the cot, at least keep them in the cot until 2.5, until they neurologically get that or have that development. But it really is your choice. Keep them in your room for at least the first year, or bed share for at least the first year, then pop them into their own room, or keep them in your room. The choice is yours.
That's really good. I think as we begin to wrap up, Nicci, here's a question, one more question for you, is who needs sleep more, men or women?
Okay. Do I reply as a woman or as a professional?
As a professional, please.
Okay. Unfortunately, the answer is always going to be the woman. Because the woman doesn't just care for baby, she cares for men as well. So when it comes to sleep, it is man's responsibility that Mama Bear is being well slept and well looked after. Because at the end of the day, she is the nurturer. And in order for her to do her job well, she needs to be cared for. And she might look like she's doing well, but on the inside, she might be a steam train with no coal.
I actually really love that, and I love the way you put it even. You know, and I think so many women in particular, when you start having, when you have particularly your first child, and a lot of women feel like they're going to push through it, and they're stronger than this, they'll manage at night, but there's the other advice that you need to be able to take naps when the baby's napping. How do you, as a first-time mom with a newborn baby, when do you find slots to sleep? Do you sleep when baby's sleeping? But then how much of that should you be doing so that you can function and cope normally?
So for my newborn moms, I put them on the easy program. So it involves eat, activity, sleep, you. So it's EASY. So baby eats, baby has a small activity, baby sleeps, and during baby sleeps is you time. So you do absolutely nothing other than something that replenishes you. So
Wow.
if you need to take a bath, you bath. If you need to read a magazine, you read a magazine. You take those early weeks to do nothing other than replenishing the new mom that you now are. You don't need to do the washing. You do not need to do the floors. You do not need to look after your husband. Your only responsibility is building the new mom that you are right now, because that is a new responsibility that is going to take the next 18 years of your life. So the first 12 weeks is developing the foundation of a new role.
Mm-hmm.
That's all you have to do, is concentrate on the new you.
Here's just maybe one more question that Zamabella is asking, and I've seen lots of women, fitness panda, saying she needs more sleep, definitely. But this question says, what routine do you need when it comes to having a second baby now? Because that kind of throws out the dynamic and the focus. Having a second child can really, really change the game.
Okay, so I can absolutely understand that, having more than one myself. So, second baby gets a whole lot less attention. What we do is, with your second baby, unfortunately, attachment parenting or gentle parenting can often have less effect. You find that with your second child, you tend to be a little harder in regards to when your baby goes to sleep and how they stay asleep. Your second baby tends to cry a little bit longer, and you tend to expect them to go to sleep a little bit more independently. So you find that your second child tends to be a little bit more independent because you kind of give them that responsibility very early on. So you know their awake windows, you know their sleep times, and you kind of just get on with it. Your first child never stops being your first child. They always are treated a little bit differently than your second. So a lot of moms will always say to me, I don't know how I'm going to cope because my first child takes so much attention. That first child never really stops having that much attention. The second one just kind of rolls with it. And that child has a different kind of parenting. And that's okay. Your two children aren't the same children. They're different children and they have different parenting. That's okay.
Zamabella says that's helpful, but brutally honest, and I would agree, Zamabella, and I agree completely what you're saying, Nick. You know, having two kids, you do end up raising them differently, and the one that gets more attention than the other at some point. It's very hard to split and be equal and be the same. You know, even when it comes to just giving them stuff, we realized the other day that my one child has more toys than the other child, but that's just the reality of life, unfortunately. But I think it's what matters the most is that you love them equally, and that they have your attention, and that you're there for when they need you the most. And I think that will never be taken away from you. So it is different. It changes not just sleep routines, it changes in every area of life. So it's something we just have to adjust to. My time with you this morning, I think, is up, but it's been really, really fascinating. We had so many questions coming, Nicci. We might have to do another session around sleep in particular. We didn't even touch on sleep in pregnancy and how just do you adjust to finding sleep when your hormones are changing and this body you can't even turn over anymore. And you know, there's so many different nuances when it comes to sleep that we all struggle with. So thank you so much for your time. Just before you go, if people need assistance, Candice had that question that she was dealing with. How can they get hold of you and where can they find you?
Very simple. They can pop onto the Instagram page, which is at Bedtime Baby Bliss. They can pop onto the Facebook page, which is also Bedtime Baby Bliss, or straight onto the our web page, which is also www.bedtimebabybliss.com. They'll find me.
Awesome. That's as easy as that. With this recording will be up on our stories for the next 24 hours as well. So if you've missed anything or you want to go back, we joined the conversation late. There was lots of tips that Nicci gave, a really practical advice on dealing with sleep and parenting. So thank you so much for your time, Nicci. We will speak again soon. That's for sure.
Fantastic. Great. Thanks so much, Shay. You enjoy your day.
Have a lovely morning. Thanks to all the moms that tuned in. Thanks so much, Fitness Panda, for all your questions. Thanks, everybody. We really do appreciate it. If you've got any more and you want to hear more from us, then please go into our stories, send us a DM. Tell us what you would like to hear from these MamaMagic live sessions, and we'll find the expert that can help you in your parenting journey. If you need some assistance, we can always find the right person for you. We're here for you during this time. It's never easy. You might not be able to leave your house, but we'll keep you connected. We will keep you entertained, and we will make sure that as MamaMagic, we provide you with the best that we possibly can. Myself, Warren, I'm the brand director of MamaMagic. Stay safe, stay at home, and stay strong. This has been it from MamaMagic Live today. Thank you, everybody. Thanks, Nicci.
Bye.
Bye-bye. And I'm going to just share this through to everybody's pages so that you've all got that. And we will make sure that this is on our live feed before I end this. That's it from me. Goodbye.